Hi everybody, we're going to pick back up with nerve impulse transmission. We're now going to talk about the synapse. This information comes from page 98 in your course pack. In order to review this information, let's look at a picture of a neuromuscular junction. The neuromuscular junction is the actual place where the axon terminal nearly comes in contact with the sarcolemma of the muscle cell. Let's zoom in on this location right here and look at it up close. Here you can see the axon terminal. Here it's labeled as the presynaptic knob or presynaptic membrane. This portion here, of course, axon terminal. And down below we have the postsynaptic membrane, which is actually the sarcolemma of a muscle cell or a neighboring nerve cell. The space between the two is called the synaptic cleft. And what happens here is the synapse. We call this a chemical synapse because we're going to use a chemical neurotransmitter to relay the information across that synaptic cleft. Now, you've seen this story before. We've discussed this back when we talked about muscles and excitation. This is the exact same process. So when the action potential or nerve impulse arrives in the axon terminal, calcium channels here on this neurolemma open up and calcium flows in. And that prepares these vesicles here of neurotransmitter to be transported to the edge of this neuron and then released. We've often described them as a blister rupturing. So it's exocytosis that allows that movement, and now these molecules of neurotransmitter are in the synaptic cleft. In the past, we talked about acetylcholine as being that particular neurotransmitter. There are others that we'll talk about later on. These neurotransmitters will travel across the synaptic cleft. They will bind to receptors on those protein channels. Oftentimes we talk about these being sodium channels. When that neurotransmitter binds, the channel opens, and of course that ion can travel through that open channel. So if in fact we are looking to excite a cell, this could be a sodium channel, and the sodium ions then rush into that cell. Here again you can see an up-close look at the synaptic cleft between the axon terminal and a neighboring cell. Of course, the axon terminal's membrane is called the presynaptic membrane, and the neighboring cell to which we are transmitting a nerve impulse is called a postsynaptic cell or membrane. You can see when the neurotransmitter binds to that channel opens and sodium enters into that cell through the open channel. Once the neurotransmitter has been broken down, oftentimes by an enzyme, then that channel closes, preventing further entry of ions into that cell. So let's talk about EPSPs and IPSPs for just a moment. They're on the bottom of page 98. EPSP stands for excitatory postsynaptic potential, whereas IPSP stands for inhibitory postsynaptic potential. To understand excitatory postsynaptic potentials, or EPSPs, let's talk about depolarization. When depolarization occurs, what type of channel opens, sodium or potassium? Well, sodium channels open. Sodium travels into the cell. Sodium causes the inside of the cell to now become positive. Okay, so depolarization can lead to an action potential if we reach a critical value known as threshold. You may recall that threshold is negative 55 millivolts. If we reach that value, then depolarization can lead to an action potential. So EPSPs are excitatory postsynaptic potentials. They cause sodium channels to open, they promote depolarization, and if threshold is reached, action potential can then occur. So in your mind, you want to associate depolarization with an EPSP. Cause excitement, promote depolarization. By contrast, hyperpolarization can lead to the cell staying at rest and not leading into an action potential. Inhibitory postsynaptic potentials cause potassium channels to open, as you can see here, and not those sodium channels. So when potassium channels open, potassium leaks out, and that creates a more negative charge inside the cell. We know that negative 70 is resting stage, so it can become negative 90, negative 110, and so forth. So the negative setup inside the cell is going to be what happens during hyperpolarization. So in your mind, you want to associate hyperpolarizations with IPSP. So yeah, a hyperpolarization can occur during the refractory period when a cell repolarizes itself, or it can also occur as a way for the cell to remain stable at rest. This way, there's an unlikely opportunity for it to reach action potential. So here you can see with an EPSP, we move more close to threshold at -55, while an IPSP actually moves us further away from our opportunity to reach threshold. So if you think about it this way, which of these scenarios would make you more likely to produce an action potential? It would definitely be this EPSP, not an IPSP, because the EPSP is the one that moves us closer to -55.